Welcome to Continuing Education module on budgeting tips for wellness programming using financial resources wisely. Our agenda for this particular module includes a perspective on budgets, wellness in America, and looking at the pattern of the adequacy of funding of wellness programs, budget marks, expectations for how much it costs for various interventions in a wellness program, technology-related costs from the technology infrastructure, those core components that reach 100% of your population or potentially reach them, program model costs and how those vary, budget stretchers in terms of being able to get the most out of your wellness budget, questions for your health plan in terms of weighing free or low-cost services and their adequacy and appropriateness, budget wisdom as to how you deal with the budgeting phenomena within your own organization, and finally, a summary of key points for this particular module. Let's start first with a budgetary perspective, and this data you may have seen from previous modules. It looks at the combination of the BLS Employment Cost of Compensation Index and adds an article that had to do one of the more well thought out methodological approaches to presenteeism done with Dow Chemical Corporation. And we combined the data, reduced the amount from the Collins article by half of what the perspective was that was reported for the 56,000 employees of Dow Chemical. But it puts into perspective a little bit more of the cost and economic cost for wellness and for worker health. And what you see here essentially is a presenteeism. That's the 18.5 thousand per year per employee. So these are PEPY per employee per year costs. The health plan cost comes next at about 13,000, and that's probably in 2017 is up around probably closer to 16,000 or so per employee per year when you combine the single employee coverage with family coverage and you average those out, you're looking at about 16 grand. In the next area, sick leave, about $2,200 per year, and that's about 8 days of sick leave for the average employee. And then the next area is workers' comp costs, which is about $800 per person per year. That can be much higher depending on the type of occupational risk exposure for illness and injury. And the last category is disability, and that's the short-term disability, long-term disability, approximating on a national perspective about $1,400. So these costs were derived from BLS data on Employment Cost of Compensation Index. It used that, and that essentially means that all of those costs, the combination of presenteeism, which are not reported by the BLS, plus the BLS items that are reported on the left-hand side of the pie chart, totals about $36,000 per employee per year. So that's the budgetary perspective. And then also to think about wellness, an average amount for wellness that's spent nationwide is probably, it's less than 300, but even at 300, which is a fairly good funding for a vendor budget for a wellness program, that's less than 1% of the amount that we essentially spend or obligate based on issues of employee health or worker health. So this budgetary perspective advocates that you look at these five economic variables, and that you look at the total and then relate it back to the average cost that we spend on wellness. So we're essentially spending less than 1% to affect a fairly large cost of doing business. It's one of the larger costs besides strict wage and salary costs. But it does in fact add up and has some significant economic implications for most work organizations. Wellness in America, if we looked at a 2x2 analysis and we essentially said we can look at whether a program is effective or ineffective, if it is adequately funded or underfunded, and if we then label those, If you are in A, you are underfunded and relatively ineffective. That's where the majority of employer wellness activities in the US are. So probably 70 to 80% of all the wellness being done is in that category. The B is you're effective, but you're underfunded, and that's fairly rare. So what we're looking at there is a very well implemented, executed program with a core design, perhaps not spending all the money they could, but able to document some meaningful results from their programming. C would be adequately funded, but relatively ineffective. And there's definitely 3 to 8% of the wellness U.S. employer wellness efforts are probably in that category. And then finally, in D, you're adequately funded and effective. So part of our challenge is how do we help people move to D and to recognize that the per employee per year cost is likely to be at adequate funding somewhere around $300 to $600 per year per employee. That does not necessarily include the staffing costs for the program and incentive costs. Those can be actually done in many different ways, so we don't generally add them to our estimate of the budgetary needs of a wellness program. But if you have allocated anywhere in the area of $300 to $600 per employee per year for your wellness program cost, that's probably, again, what we would consider as the adequately funded level of programming. And in the underfunded, if you're anywhere under that 300, that's probably at a level where your wellness budget by itself is relatively underfunded. And the issue here is it's very difficult to get to D. My own experience with about 1,000 employers points to the fact that you have to get a strong economic rationale lined up with a strong humanitarian rationale in order to get adequate funding of these kinds of programs. And then you have to implement the program in a way that is likely to produce results. So this is a little bit of a context of looking at what the worksite wellness industry is in the US at the current time, and it just identifies the two major issues of funding adequacy and the relative effectiveness of the program. Now, typical budget marks, as we look at some of those, these are all different interventions. You can see them identified by health coaching, for instance, at high risk, or a health risk assessment online, and wellness newsletters, or biometric testing, more extensive versus standard, fitness testing, e-health portal, fitness club dues, wearable device and platform. So these are some of the estimated costs, depending on what area of the country you're in, what size employer you are with, because there are obviously economies of scale that come into pricing when you are buying various services. So it's going to lower the unit cost per participant cost for you to actually be buying more of these services. So that changes significantly the marketplace characteristics and the way in which you've crafted the program. So these still give us some range of idea about how you might look at the budgeting phenomena and the various interventions that are typical interventions in worksite wellness programs. The typical wellness and technology costs we'll go through, and this you have seen from previous modules where you have the individual, he or she takes a health risk assessment or a well-being assessment. It's computer processed. You may get a personal report back. That may trigger a coaching contact from a wellness coach. It may trigger a referral. It could, in fact, also lead to some sort of welcome kit where you are given some materials as you enter a program. Health guides are more the self-directed change, online and or paper-based instruments that can be used to help people begin a behavior change. Email and mail messaging really kind of reinforces or can reinforce some of the issues around wellness. A wellness newsletter can be electronic or paper-based, and it can basically educate people and help with their health literacy. The PCP, or primary care practitioner summary, oftentimes can be a part of the personal report and can be taken in to show the individual's primary care practitioner what's going on in the wellness program that they're involved in. And then the online e-health portal oftentimes has a number of different functional capabilities. These are not necessarily used very effectively. We don't do a lot of demos. We don't create incentives for use. We don't establish long-term use patterns, and therefore these devices are not necessarily used very well. And then we have incentives for wellness that could potentially affect all of these different parts of the technology infrastructure. Now, as we think about costs of these, first of all, the HRAs tend to be no cost. They tend to be rolled into either an eHealth portal or into other preventive screening tests so that they aren't broken out as they used to be in terms of individual cost. The personal report is oftentimes online. That ends up being a no-cost item as well. Around $94 to $100 per participant per year is likely to be the telephonic coaching cost, and that depends on obviously the configuration, the protocols that are used to provide direction to that coaching process. The welcome kits can average $8 or so, depending on what combination of materials are in there and whether they are more polished or developed or purchased materials. Health guides can be another $6. The email and mail messaging usually does not come with a cost, although it's possible to find vendors that are actually charging for messages which are sent out, either blast or all hands type of messaging. Wellness newsletter, no charge, so a lot of those are distributed for free now. They used to be cost related. PCP summary, no cost. eHealth portal, $14 per employee per year, or per employee, some of them are per employee per month costs. So these are all different cost variants that you can find, but a low cost one would be around $14 PEPY, per employee per year. And then the incentive cost will really depend on how the incentive is created, whether it's employer funded or whether you're using a premium contribution that's created for the wellness program, which actually has no cost to the employer, but uses employee dollars to provide the incentive effect. So if you added all of this up, you're going to be in the area of maybe $120 and $130 for the core technology that's in this technology infrastructure. Now, the program model cost range is going to vary depending on which of the three strategies or program models you choose for your wellness program. The Feel Good model tends to have a $0 to $99 a year as the average cost per employee per year. The traditional approach goes from that 100 to $300, and then the results driven is $300 to $600. So these are still relatively small expenditures, but they're discretionary expenditures. They're not required. They're not compliance oriented. So the employer still has the difficulty of stepping up to the financial obligation and attempting to do wellness in a way that fits with and aligns with their expectations about the program's results or its effectiveness. So these, again, are some of the amounts that you might see in the vendor budget for these given models. So your model will influence your cost, PEPY costs. Now let's look at some budget stretchers, and these are categories of things that are available from different sources that reduce the operating costs of your wellness program. Some examples include, for instance, if you're using local nonprofits, and those nonprofits have either marketing budget or they have prevention or community prevention budgets, you can use those community hospitals, YMCAs, to provide low-cost services to your employees. The national nonprofits include the American Heart Association, the National Cancer Society, the American Diabetes Association or Dietetics Association, the National Health Clearinghouse would be another one of the groups that are in that national nonprofit related group. They provide services of different kinds. Some of them are free, some of them are low cost, but those are resources that can meet some of your wellness needs. The federal health agencies that are involved are the Centers for Disease Control, and you can access what's called the National Healthy Workplace Program, and that has a number of resources available for employers. There's the Office of Health Improvement and Disease Prevention. That's a part of the structure of the Department of Health and Human Services. There's the National Health Information Clearinghouse, which has the Health Finder series and a number of other low-cost resources that can be used for wellness programs. There's the National Institutes of Health that has a variety of different kinds of consumer materials available online that can be printed off and used for your wellness program. So again, the federal health agencies are a source of many budget stretchers. You also have a state health department in each state, so you need to contact that state health department. There are also resources that are oriented around hypertension, cholesterol, issues around injury prevention, issues around chronic disease prevention in general. And then there also are dedicated worksite wellness resources at the state health department level, depending on which state you're in. So you can find toolkits for building up your program, you can find resources, but you have to kind of pursue those through your own health department, and that's state health department. On the local health department, depending on whether you're in a suburban, urban area or a rural area, will determine what resources are available through that local health department. Sometimes the state health department resources are actually available through local health departments. And again, the larger health departments have some dedicated worksite wellness resources that you can access. In addition, you have health plans. So a lot of the major players on the national level, Cigna, Aetna, Humana, the Blues, all of which have some level of investment in wellness. There's a few that have very little, but many of them have quite an extensive array of programming. Most of that programming is not utilized very effectively, so it tends to be on the shelf, but not necessarily engaging with employees. So that's where the design of incentives comes into play, and that's where the employer's ability to have ownership over the program is important, rather than having a vendor like a health plan actually be your wellness program. So it's not really your employer wellness program, it's a health plan employer program that oftentimes is underutilized by the employer. And then there's higher ed. Higher ed has a number of resources that can be used. So there's medical related, health plan and other disciplines, health promotion as well. So those higher ed facilities oftentimes have resources. If you contact them, there may be students that can provide work for the evaluation of your program, and or those that are in training to do things like screening, so that you can in fact tap some of those resources. So you want to approach the higher ed resources in your area. And then some of the national resources we want to underscore. Health.gov is a major website with a lot of health-related information on it. The healthfinder.gov is another series funded by the National Health Information Clearinghouse. So these national resources can be very helpful for you. These are all budget stretcher examples, and they can add to your program without adding a lot of cost to your program. But you have to remember, does the resource you're talking about and working with, it may be free, but does it AMSO? And that means, does it have the 4 characteristics that are key to an effective wellness program? 1, does it help you raise awareness around health, personal health, and wellness issues for your individual employees? So does it perform an awareness building function? Secondly, the second issue in AMSO is motivation. Does this resource contribute in some fashion to enhanced motivation for the people who are currently not intrinsically motivated to do wellness? So it takes oftentimes an extrinsic source of motivation to do that. So you have to ask the question, do these free resources contribute to increased motivation for engagement on the part of the population I'm working with? The S in AMSO stands for the fact, does the resource that you're considering at low cost help people increase their skill level around the new behaviors that are healthy? So does the program actually have a way of using the resource that you're considering for a low cost budget stretcher to use it to actually build the skill level of the individual in making a behavior change? And the O in AMSO is basically looking at these free resources and asking, does that free resource fit with our ability to structure opportunities for people to practice those new skills that they've acquired around a new behavior? So what we want to be doing carefully is we want to extend our programs with low cost or free resources, but we also want to make sure that those resources contribute to behavior change, long-term behavior change on the part of the population that they're designed to serve. So these are some of the considerations and examples of budget stretchers in this particular module. Now, questions for your health plan. And the basic issues you want to be asking the health plan as an employer is what services are available through you to serve the clients or the registrants or subscribers, however you call them, that are enrolled in your health plan, and what services are available for them. So you want to ask that question first. Secondly, you want to find out, ask them to tell you what their strategy is around wellness. Is it compatible with the strategy you're using with employees? Does it AMSO? Does it, are you following that, and are they following that? Because that's kind of the gold standard for whether the program's going to produce long-term behavior change. Also, do they provide any consulting help? Cigna is one of those organizations that's dedicated a large number of staff to doing well-being strategy work and wellness program called consulting work. So does the health plan have a consulting staff for wellness? Can you get some help from them? You also need to know from them what's baked into our premium. So when we're, as an employer, paying a premium for X number of employees, of our employees, what's baked into that premium that is wellness oriented? And then in addition, you want to know what's extra. What are the extra services and what is their charge? What is your charge for them in terms of how they serve our employees? And by the way, you probably want to find out, will they serve with wellness, their wellness interventions, will they serve other individuals that are not on their health plan? And if they will, what's the fee for that? So it's really determining, those things. You also, do you have any dedicated funding for wellness? Cigna actually has wellness credits. Wellness credits are increasing in their prevalence in our employer health plan system. So the way in which the employee or the health plan has dedicated funding for wellness and then gives that to the employer to work on wellness programming for their employees and family members. In addition, what services are not covered or non-covered? Is the service that they're providing not covered under the health plan coverage? And availability of data. So how can they service the non-covered? Let's go back and redo that one. The service the non-covered means those people that are not under your health plan and not enrolled in your health plan, do you serve them? And then if you do serve them, what's the additional cost that it would cost us to have them have access to your wellness interventions? And then availability of data. How much of the data which is provided around the claims experience of these groups can you share, and how much of it is going to be used or useful for purposes of doing a claims analysis on our population, both in a prospective way of being prescriptive about what we do in wellness and also to evaluate changes over time. And then the issue of how does your health plan deal with the AMSO concept? How do you structure and approach the long-term behavior change on the part of your populations that you serve, and where does AMSO get addressed in what you're able to do for individuals in terms of wellness? And how well and what do you do in terms of follow through? So can we have maybe some references of other employers that you're doing wellness for that we can talk to find out how is your follow through on being able to do that? It's customary that the sales staff, when they are marketing a health plan, will oftentimes make statements about what can be done in terms of wellness. And then what happens is after the employer starts to use the health plan, they begin to find out that all of the statements that were made in the sales process don't necessarily happen the way the salespeople portrayed it to happen. So you want to try to find that out before you're in a relationship with a health plan. Now, the funding level and program model effects on ROI. We want to look at some dimensions here. And the CB ratio you're going to see along the axis on the left, the x-axis of the y-axis has average program dollars of investment per person per year. So that's a PEPY kind of level of funding. And if we look at the chart and we look at the three models, the feel-good model doesn't even get up to a 0 level. So it doesn't even show up here. So the feel-good model is not going to pay for itself. And the issue around the traditional model is that we can be in the downside, the beginning side of the curve, and actually not be able to attain the level of return on investment or cost-benefit ratio that we might expect. At the same time, there's a point of diminishing returns where you start to spend more money on it than you're getting back from it. And what you probably want to be doing is spending on wellness, depending on which model or strategy you end up pursuing and using, you want to be at the maximum point, the apex of the curve. You want to be at the highest amount where your amounts of spending is in fact the highest in terms of the ratio and relationship to economic return. And then if you look at the results-driven model, it's obviously a higher model. This is based on a number of different studies. It's not based on any one study, but what it does is it incorporates both the dimension and variable of average program dollars of investment per person per year against the reported cost-benefit return. So the highest level is probably going to be around that 450 to 500 level. There also is the point of diminishing returns. You can also be at the front end of the curve where your level of funding is not adequate to actually get to the higher levels of economic return because you're not doing the interventions that are likely to be contributing to the long-term behavior change, which then contributes to risk mitigation, which then contributes to improvements in health status, which then contributes to greater economic return. So those are some of the perspectives around our funding level and the program model effects on return on investment. Now let's look at some practical budgeting tips, and let's start out. First of all, my general recommendation is you try to use a 3-year project period with annual budgets. So when you're starting a wellness program, my advice to you is use a 3-year project period, get your management to agree to that 3-year project period. You can look at annual budgets, and you probably want to do more work on the one coming up, the year coming up. The second and third years can be put off while you see what kind of response you're going to get, because part of the cost of a program is generated by the levels of participation that people experience or show in a given program. You also want to budget in a PEPY terms. So instead of talking about the total dollar amount in dollars, you're better off if you talk PEPY. It breaks down the cost into much smaller increments. It shows the incremental nature of the program funding compared with things like health plan costs. where you are looking at a very small percentage, 1, 2, 3% of the cost of the current health plan coverage. So budget in PEPY terms. You want to use low-cost resources when possible. So you want to augment that with budget stretchers, particularly those that contribute to or add or are complementary to your AMSO approach for programming. Now, those are the mainly the Pareto group, the largest, most significant items. In addition, you want to use a range when estimating costs. So instead of estimating and having a fixed dollar amount, you probably want to have a range and use a range. It gives you a little more latitude, particularly when you're starting out programming and you're not quite sure what kind of uptake you're going to have from employees, and the uptake or participation is going to drive your much of your variable budget. So that makes sense for you to use a range when estimating cost at the beginning. You want to keep reminding your senior management about the percentage of health costs that this investment in wellness represents. You need to keep putting that in front of them because they keep forgetting it. And you want to include spouses where possible, because we get some added effect from spousal involvement. We get some increased effectiveness on the wellness long-term behavior change, and we get some potential effectiveness of having wellness in a spouse that's then maybe not covered by the health plan originally, but then ends up coming under the employer's health plan. So you get the benefit of that wellness effect on the spend rate and the claims experience of those spouses. In addition, you probably want to use a budget plan to report. So you want to use the way in which you've presented the budget to help you structure the report back in terms of how much activity took place in the wellness program. You also want to use employee dollars for incentives. So anytime that you can create a $50 a month or $100 a month amount, there's a premium contribution that's added to everyone's health plan cost, that then can be waived for various involvements in participation and or outcomes, what are called health contingent types of incentive programs, so that you in fact have a way of using employee dollars to create the motive force for engagement in your program. And you also want to seek partnerships where appropriate. So anytime that you have a partnership that you can develop with another player, either internal or external player, that's a useful thing in terms of extending the effects of your program in terms of its budgetary effects and spreading that cost over perhaps more individuals. More budgeting wisdom includes you want to stay in budget. So once you have a budget, you want to be a responsible manager and stay in budget. You want to integrate deeply, and you want to have wellness actually show up in lots of different places in your organization. And you want to follow your management's lead regarding the program. So the things that they are aware of that are reasonable, if they have unreasonable kinds of beliefs or thoughts or expectations about the program, then that falls on you as a program manager or program coordinator to help disavow them of those unrealistic expectations. So you want to follow a reasonable management lead. If management is leading in a reasonable way, if they're unreasonable, you need to be working on helping them to become more reasonable. And the other elements are oftentimes highlighting efficiencies. So anytime you are using these budget stretchers or you've gotten help with a partner or whatever it is, you want to highlight those efficiencies. You want to emphasize the collateral benefits. And those collateral benefits can oftentimes be structured in what are called value on investment. So return on investment works with those 5 major economic variables. And then it compares the direct cost of the wellness program to savings that accrue in those 5 areas. And again, those 5 areas are health plan costs, sick leave absenteeism, workers' compensation costs, disability insurance costs, and presenteeism related costs. And you then want to emphasize the value on investment, which are things like retention effects, morale improvement, loyalty improvement, the ability to recruit people more easily. So we look for other kinds of collateral benefits in addition to the economic benefits associated with these kinds of efforts. You also want to keep their perspective on the dollars here. We're not talking about a lot of money. In fact, we're talking about a very little money. It's probably equates to less than the cost of a latte every other day for an individual employee. So we're not talking about a lot of money here, but we are talking about money that's not required to be spent. It's discretionary, and it comes up under the leadership of your senior management. So you want to keep the perspective on the dollars you're trying to affect with your program versus the cost of the program itself. And you want some feedback on a metric story. So you want to be able to talk about your wellness program in a way that is a metric story. It says, here's where we were before, our health plan costs were going up this much on average. Now we've implemented wellness. We believe that's contributed to a much slower rate of growth in our health plan costs. That's an example of a metric story. Each organization needs its own metric stories. So not just one, but several things, and they might relate to sick leave or workers' comp or disability or presenteeism losses or health plan medical trend. And you want to evaluate annually. So you want to be looking at your budget, its adequacy. You want to kind of decide, are we adequately funded? Can we produce the results that management expects with the resources that we have that are provided to us to use? And you want to share the benefit of referrals at times. So if you're referring to a local hospital that's making a lot of money, maybe through your health plan or maybe through the pocketbooks of your employees, you probably want to be going back to them and say something to the effect of, you know, we just realized that we've sent you 80 referrals, and the average amount you're charging for those is $1,500 a piece. We'd like to see you either reduce your cost of this to the employees or to our health plan, or help share some of the rewards with us in the form of maybe some incentives that you can provide. So maybe you buy 5 mountain bikes that we use as giveaways for our wellness program. So you can creatively look to share some of the benefits of referrals that come out of the process of wellness for your employees. Now, a summary of key points for this particular module. Getting budget resources for wellness is always a challenge. Very few situations are flush with money and you end up seeing a lot of money go into wellness. That's a very rare phenomena. So almost every wellness program has to struggle for its budget. And 70 to 80% of wellness programs in employer settings in the US are underfunded. So they don't fund them at a level to produce much in the way of results. But any wellness amount is a small percentage of the worker health costs of a workforce. So it's very powerful when you can document what those costs are for your own employees, and then talk about the wellness budget as being less than 1% of what you're currently spending. And you're spending that to help defray the rate of growth in those health costs in future years. And that's what we call part of the economic rationale for doing wellness. Wellness vendor budgets are in the $50 to $600 per employee per year range and relate directly to your wellness strategy. So the kind of wellness program model that you're using or strategy you're using will have a lot to do with how much your vendor budget is. Now, vendor budgets don't have costs for staffing of the wellness program and or incentive costs, because there's lots of different ways to structure those two. I can use free resources or low-cost resources to staff. I can have a vendor actually do the staffing. So I don't want to include that because it really would be double counting in a way. So the idea is we're not looking at a lot of money, but we're looking at money spent wisely and oriented to reduce further expenditures for future time periods. And adequate funding and sound program design are the real challenges that we face. And that goes back to that 2x2 analysis. You want to use a per employee per year approach in program budgeting if possible. So some vendors tend to use per employee per month. So it's PEPM. But if you think about overall spending for your wellness program in PEPY terms, I think you'll find it breaks down the amount and the number, and it puts it into a much better perspective than just simply saying we need $600,000 for our wellness program, because everybody, hiccups when they hear that. Augment your budget with low-cost resources where possible. So you want to use carefully those low budget stretcher, and this is particularly true in the programs in the public sector, where there are city level wellness programs, county level wellness programs, state level wellness programs, federal programs. It's where you don't have a lot of budget dollars. You want to be able to use low-cost resources as long as they contribute to your program's effectiveness. If those resources are not really doing much for your AMSO and you aren't watching the AMSO, then you're not likely to have a program that's going to produce much in the way of long-term behavior change. Remember, return on investment is linked to the adequacy of funding and your program's design. So the program model is what the design implies, and the adequacy of funding just means you've got to be on the curve. You've got to be at a place where the return on investment is in fact enhanced and at a minimum level. And finally, you want to stay in budget, remind managers of relative budget amounts and the smallness of these, show efficiencies and savings efforts, and feedback key metrics. So those are a summary of the key points for this particular module. Now let's answer some key questions. Your first question is, what is the best way to fund a wellness program? And my recommendation is you fund it through the health plan, and you essentially create a reserve that you fund that pays for the wellness program. I would use that approach. In addition, I probably would say that you would have a premium contribution increase to fund the program's incentive, where you essentially add a $25, $50, $100 premium contribution to all employees that are covered by your health plan, and they can essentially have that removed or waived by their involvement in wellness. And it can be involvement like participation, or it can include outcomes, actual behavioral outcomes. So that's the best way of funding it. And I think that the way of structuring this is to have the employer pay for the actual program interventions. That's the wellness program vendor budget. And then have the employee essentially pay for the incentive cost. And that's what I call a partnership. And you use budget stretchers liberally to enhance your program, but also to increase its efficiency in terms of its economic efficiency. So that's the best way that I've come across to fund a wellness program. Second question is, what makes it so difficult to get to D in that 2x2 analysis? And just as a reminder, D was inadequately funded and ineffective, or no, the other way around, adequately funded and effective. So we want the adequacy of funding and the effectiveness to be there in that D space. And the reason why I think it's so difficult for employer wellness efforts to get to that D place is we have too much free yet ineffective programming available. So what happens is, if you are not aware of the behavioral change issues in a wellness program, you are likely to use free resources that don't really contribute to long-term behavior change. So you end up doing things but not seeing much change take place. And I think that too much free resource undermines the value of wellness across the spectrum. And the proponents of free resources will tell you, well, you want to make it easy for employers to do wellness. And I agree with that. but I don't want them to be doing wellness in such an easy fashion that it has no effect on the health of the population. And that's where our problem essentially comes from. The second reason that I think it's difficult to get to D is there's inadequate understanding by management of the economic rationale, the potential economic rationale that wellness can address, and the way in which we look at wellness. So the economic rationale is not well developed in most organizations. Most senior management groups do not understand what they're spending on health or what the issues are around a wellness program addressing that. Particularly wellness programs that tend to add other pathways for changing the economics that their organizations are faced with. And that can be through things like medical self-care, consumer health education, injury prevention, issues around advanced directives or ergonomics. There's a whole variety of areas that are additional pathways that wellness programs can in fact use. And then also the third reason is I think we have an over-reliance on non-market solutions in healthcare, particularly under the ACA. We are now entering a period of time where the ACA is likely to be changed and modified by Congress. So if we get more market-oriented solutions, then I think that that will help us actually fund these programs and have them be more effective and have more reason to be doing that. But again, if we're over-relying on non-market solutions to fix the problem, then we don't put as much effort into these programs and we're not likely to get to D. And then the fourth reason is we generally have the fairly poor use of measurement methodology. So our employers that are doing wellness oftentimes don't measure what they're doing very effectively. So they are not able to track and provide feedback to management about the program's effectiveness. So we don't see where it's effective. And we oftentimes then don't realize its value. So those are those are four reasons that I think are main reasons why it's so difficult for us to get D to D in that earlier 2x2 analysis that looked at the adequacy of funding and do the programs produce results. Question number 3 is, how can your wellness budget be protected? One of the things I've seen over the years in working with more than 1,000 employers is there is a group, probably a dozen or more, that I've seen where employers have backed away from a wellness commitment and actually slashed the wellness budget. And if you want to keep that from happening, you have to take some steps at being able to protect the budget. And this is where we come in talking about a deep form of integration. So we want to have the wellness program components integrated with each other. We want the wellness program overall to integrate well with the other activities like EAP or benefits or health plan or return to work or disability or all the other pieces that affect health and the health of workers. And we want that integration also to fit where our program, our wellness program, is well connected with external resources, whether those are hospital-based, local hospital, or whether they're national resources that people can use to assist them, or free apps that are available for your smartphone. There's a whole series of external kinds of integration that need to be done. The more integration you have for wellness, the harder it is for management to essentially cut out the wellness program. You also want to build it into the benefits so that the kinds of issues in wellness are in fact embedded in your benefits. It's therefore hard for an employer to change or modify those. So that's part of the strategy I believe we have to use in order to protect the wellness activity and to let it be carried on over a long time period. Also, if we want to use a 3-year project period or a 5-year project period, it helps management make that tacit obligation and commitment to have a wellness program for multiple years. We are not going to be able to do wellness do it for 3 or 5 or 7 or 10 years and then say, let's quit doing it. We don't need to do it anymore. We are always going to need to have some way of taking care of our human capital. Our human capital are the employees that we in fact employ to do a broad array of functions. So we're going to need to have a wellness program for our human capital if we want that human capital to be effective and efficient in terms of economic processes. So those are some of the reasons and the strategies that you could use to help make sure your wellness budget doesn't get cut out by management as management changes directions, new management comes in, companies are acquired and merged. There's a whole bunch of change that goes on around the direction and policies that an employer uses. So you, in fact, are doing some things to try to protect the wellness program itself so that it can exist long term and it can help people make these long-term behavior changes. Now that you've finished this module, go ahead and take the quiz.